Hello, I'm Dr. Omar Bay, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we got a great one for you tonight. We're going to talk about a topic that is something that you may have heard about on TV, but I'm going to make it a surprise. First, I'd like to talk about caring and sharing. Remember, www.medmoments.com. I really so appreciate all of your emails and your tweets. Keep them coming. You can tweet me at MedMoments. Also, www.medmoments.com. Alrighty, we're going to get to the meat of the show now. We're talking about pancreatitis today. And I have the perfect person, a physician who is at Newark Beth Israel Medical Center to talk about this topic. It's Dr. Kevin Clark, and he is a surgical oncologist. What a name. What a title, I should say. Welcome to our show, Dr. Clark.
Thank you for having me.
Welcome. Well, this is a topic that I know a lot of people have heard, and there's a lot of research and funding being raised for pancreatic cancer. Mm-hmm. But that's just one aspect of the topic that I'd like to talk about tonight. First, I'd like to talk about the pancreas itself. What is the pancreas? Just give me an idea of what this organ does.
Well, basically, the pancreas is an organ. It sits all the way in the back of the abdomen, and its principal function, well, there are two main functions. One is what we call the exocrine function, which it helps in digestion. Mm-hmm. So it secretes enzymes that helps to digest food. Right. And the other function really is in management of the sugar. So it secretes insulin, and it facilitates the uptake of glucose, essentially.
Right. So. Okay. So basically, now where is this? You said abdomen. That's a big word.
So it sits all the way in the back. So it sits right above the spine, mm-hmm. essentially. So if you looked at the belly here. The stomach is anterior. The stomach and the colon sits in the front. Right. Then behind that sits the pancreas. It's all the way in the back.
Okay. So our stomach is right. Stomach is right here, about in the middle. Right. So it sits almost kind of behind or underneath or behind the stomach. Correct. Alrighty. So I understand that it's an organ that's broken up into several, like they break it up into the head and the tail and it's interesting that they put all these names on it.
Right. It's broken up anatomically into different parts, mm-hmm. and I have a picture here behind me which we can talk about afterwards. But mm-hmm. also different parts of the pancreas itself have different sections that secrete different enzymes. Okay. So insulin is a primary enzyme that is secreted, and it's located in different parts of the pancreas. Right. Go ahead.
Let's just break down. Because this is it's a difficult topic, and right. I just want to make sure that everybody understands. An enzyme is maybe a liquid or a chemical that's let loose by the pancreas. Correct. And it does a certain function for the body. Maybe it regulates something, or like insulin regulates our glucose or our sugars. Right. All right. So if the pancreas doesn't secrete that particular element, we're in trouble. Right. Alrighty. What are some of the symptoms that you find if somebody comes, like if someone came to your office, what would they look like if they had a problem with their pancreas? How would you know?
Well, if they have, one of the common problems that you could have is inflammation of the pancreas, and that's called pancreatitis.
Okay. Inflammation meaning?
Inflammation meaning swelling, increased activity, where the pancreas itself it's malfunctioning essentially. Right. And the sort of things, the most common things, usually it's related to alcohol ingestion or gallstones. The two most common things that causes acute pancreatitis. Okay, so we're talking about acute.
Now, you mean if I have a drink every once in a while, like on weekends, I like my little, my little shot of rum there, I'm going to develop pancreatitis?
No, this usually relates to heavy drinking. Okay. So not just the routine drinking every night again. It really relates to heavy drinking.
Okay. Now, what are some of the other symptoms? Does it hurt you? Does it, you know what I mean? Is it painful or anything like that? How does it present itself? You know?
So the most common symptom really is pain, and it's usually situated right in the middle, in an area that we call the epigastrium. So it sits right here, just below the breastbone right here. And the pain is usually, it depends. It could be mild pain or it could be very severe pain. And one of the things that we look for the severity, if it's pain that goes all the way to the back, that's one of the indications of how severe the activity is going on in the pancreas.
Okay. Now, other things is there any, I mean, can you like hold your food down, or do you get, I know with the pancreas is near the liver there, do you get what they call jaundice or yellow in the eyes or anything like that? Is there any other clues to know that this may be happening?
So not usually jaundice. Jaundice usually is not associated with pancreatitis. Oh, okay. Jaundice usually is associated with pancreatic cancer, but not pancreatitis.
All right, now you fancy on me. Okay, go ahead.
Other things you get, with pancreatitis, you get what we call a systemic response. So because when the pancreas is inflamed, it secretes all these enzymes and all these chemicals, it causes all of the different functions of the body to go awry. So your heart rate goes up, you have problems with your lungs, you may have problems with the kidneys. So pretty much everything can be affected with pancreatitis.
So these enzymes that this pancreas let go into the body are pretty severe. I mean, they do wild things to the body.
Yeah.
Oh, all right, interesting. So let's look at it this way. I'm just trying to get an understanding. The pancreas is a organ that sits there. It regulates certain things in the body. So for instance, it regulates our glucose in it, and it may regulate other things. But if it gets inflamed, then these enzymes or elements are let off into the bloodstream. They go to other parts of the body, and they hurt those parts of the body, actually.
Correct.
Okay, all right then. So once you know someone has pancreatitis, what do you do? Or better question is, are there any tests that I can run that would tell me maybe this guy's got a pancreas problem, or labs or something like that I should look at, or
So I think the first thing is to suspect what the diagnosis is. So if you get a history of a chronic alcohol abuser or somebody who's had a previous history of pancreatitis, then you kind of have a good sense of what you're dealing with.
Okay.
Typically it presents with epigastric pain is another telltale sign that you may be dealing with pancreatitis.
Right.
As far as lab work, the most common thing that's going to be elevated is amylase lipase, and those are two enzymes that are associated with the pancreas. So when those enzymes go up, that's a reflection that there's damage going on with the pancreas, and that's consistent with the pancreatitis.
Oh, okay, all right. Now, since I know insulin and diabetes is all associated, if the pancreas doesn't secrete enough insulin, will that cause diabetes? Is that a possibility?
Long-standing chronic pancreatitis, but not just the acute situation.
Okay, so if it's just injured and it's going to get better,
right,
we're okay. But if it's injured and it's going to stay injured for a long time, then that patient may develop diabetes?
Yes.
Interesting. Yeah. So how would we have to handle that then? We would have to give that patient insulin to control their blood sugar, because that's what the pancreas is doing normally?
Essentially, you'd have to replace insulin. And one of the things is when we do surgery in the pancreas, depending on how much of the pancreas we remove, you may have to replace that function. So you may end up giving these patients insulin.
Okay, so you actually, I know you're an oncologist now, we're going to get to that part of it, but you actually go in and may take out portion of the pancreas and leave a portion so that maybe they'll continue to have some function, but you may have to support some of the enzymes that it's not able to secrete.
Right.
Oh, interesting. Now, as far as other things, there's something else that the pancreas secretes. It's called a word called glucagon. That's one of the enzymes as well. And I understand that this enzyme is secreted if you, like insulin is secreted when you eat.
Right.
So you eat, your blood sugar goes up, and you say the body's like, hey, we got to get that blood sugar under control, and they shoot out some insulin and control it. Glucagon is the type of element that if you're not eating, if you're fasting, or if you're very hungry and you haven't eaten in a long time, that one is secreted.
Right.
What does this do? Does that help put glucose in the system?
Right.
How does that work?
So, in addition to other parts of the body, other systems, if the glucose is low, then the pancreas is going to secrete glucagon.
Right.
And that facilitates glucose release from other sources to bring the glucose up.
Oh, all right. So which organism, what organ, is it the liver, or where does this?
The liver also facilitates and participates in that.
In that. Boy, it seems, I mean, this is I want to make sure that we understand what we're talking about, because it's an organ that is important, but what it does is a little complicated sometimes.
Yes.
So we need to go over it maybe a couple times so I can understand it, so that the audience can understand it as well. Now, you said that what causes acute pancreatitis, and this is swelling, like a kind of an instant swelling because something injured the pancreas.
Right.
You said alcohol. What about different kinds of drugs? Do they, like medications or drugs, will that cause it as well?
So classically, the ones that are known to cause pancreatitis, certain HIV medications do, certain diuretics do.
Diuretics are like water pills?
Water pills.
Okay.
Those are the ones that commonly are the ones that cause damage to the pancreas.
Okay.
Other causes that are not so common, if you have hypercalcemia, which is an elevated blood calcium level, that can cause pancreatitis. Certain viral infections can cause pancreatitis. Right. But again, by and large, the two most common causes of acute pancreatitis are going to be alcohol-related and gallstones. Gallstones.
Now, you're talking about regular old type of gallstones, like you eat too much fat and you develop the gallstones and you have your gallbladder gets inflamed. Now, what happens actually with that? I know that the pancreas, now I understand now that the pancreas secretes all of these enzymes. There must be a channel that these enzymes are going through.
Right.
So how does the gallstones affect the pancreas? What's actually happening there?
So what happens is the way how the anatomy works, the duct leading from the gallbladder, which is called the common bile duct, and the pancreatic duct, they have a common channel, and that leads into the intestine. So what can happen is a gallstone can obstruct not only the common bile duct, but obstruct the pancreatic duct.
Okay.
And when the pancreatic duct becomes obstructed, that's when you can get acute pancreatitis. So it's the transient obstruction from a gallstone from the gallbladder obstructing the pancreatic duct, and that's how.
All right. So that duct gets obstructed. You mean the channel that these enzymes are flowing down gets obstructed, and then those enzymes kind of back up to the pancreas,
right?
And then they have a lot of toxic or they do bad things to everything.
Right.
So if they back up, they're doing bad things to the pancreas itself. So that's why you get the swelling.
Correct.
Oh, all right. Then now I understand. So if you were going to do different types of studies and stuff like that, things like X-rays. Do you ever do X-rays of the abdomen or the chest and stuff like this to try to figure out what's going on?
So usually the first test we start with is a sonogram or an ultrasound, and that can give us a sense if there's gallstones present, and the patient doesn't have a history of alcohol intake, then the most likely diagnosis is going to be related to the gallstones or gallstone pancreatitis.
Right.
If the sonogram doesn't give us enough information, then the next test is a CAT scan, which is a special X-ray of the abdomen that we can see all the different structures.
Okay.
The CAT scan itself can tell us exactly what the pancreas looks like and tell us how inflamed it is. So it can tell us if it's a mild case, if it's a moderate case, or if it's a severe case.
Okay. Do most acute pancreatitis, do they get better, or do they go into chronic pancreatitis? So people will always have a problem with their pancreas.
The overwhelming majority of acute cases get better on their own.
Okay.
The treatment essentially, it's what we call bowel rest, or nothing to eat, essentially, and just give them intravenous fluids.
Okay.
those two things alone by itself, the body will recover on its own. There are very few cases that you have to intervene and do something extra. And those cases are the complicated case.
Right.
So what makes something complicated is if you have what we call pancreatic necrosis, an infection, and if you have hemorrhage or if there's bleeding around the pancreas.
Okay.
So
necrosis?
So necrosis means that the tissue is dead.
Oh, okay. Now,
So
the tissue, the pancreas tissue actually dies.
Right.
Okay, now we're good.
And when the tissue dies, it can become infected, and in that situation, you may have to go in and operate.
Okay. All right then. Good. Are there times now? You said not eating. Why can't the patient eat? What?
Because eating stimulates the pancreas, so you don't want to stimulate the pancreas while it's inflamed. You want to rest it.
It's meaning that food
Right.
will cause the pancreas to secrete more enzymes.
Right.
Oh, okay. Then that, if it's backed up or if something's happening, if the enzymes are backed up, it'll just make things worse.
Worse, right.
Okay, so how do you and how many days or how long does it usually take for the acute pancreatitis to turn around? The patient, how long can't they eat?
So it varies, but on average, probably 2 to 3 days. They won't be eaten, and then probably the whole thing resolved within a week or so.
Oh, okay.
So.
All right then. All right. And when it resolves, it's gone. It won't visit me again, right?
It depends on what they say and cause it. So if it's alcohol, if it's alcohol, it's going to come back.
I hear you. I was doing some reading and I read about something called a pseudocyst. Can you explain what a pseudocyst is?
So a pseudocyst, as the name implies, it's not a true cyst. Pseudo means false.
Okay.
A true cyst is lined by epithelial cells. It's a big word, but it's a cyst that has that's lined all the way around with cells.
Okay.
A pseudocyst happens typically after an episode of acute pancreatitis, where there's leakage of fluid from the pancreas around into the surrounding tissue.
Right.
That fluid itself can become walled off by just tissue around it. So it's not a true cyst, but it's walled off by the surrounding structures, and it forms a cyst.
Right.
So that's what a pseudocyst is.
Okay.
It's leakage of fluid from the pancreas that gets trapped around the surrounding tissue.
Okay. Now I understand I'm assuming that if this happens and there's a large amount of it, then it's going to affect the function of the pancreas.
It can, and most of the time what happens, because they can become very large, they can press on certain structures. So it can cause impingement on the stomach. So when patients eat, they could feel full very quickly.
Right.
Or it may cause them to throw up and be nauseous.
Okay.
That's one of the more common things that happens actually with pseudocysts. The other thing is it doesn't really cause problems with the function so much, but they can become infected, and if they become infected, patients can also become very sick.
Okay. Do you ever, as a surgeon, have to go in and actually drain those cysts and get rid of them or cut them out and that type of stuff?
If they're symptomatic or if they're very large, then we have to treat them. Now, we used to always go in and operate and drain the pseudocyst. Now there's different methods of actually achieving this. So you can do this percutaneously with a needle, where you don't have to make an incision, or you can do it endoscopically, where you put a camera down, take a look inside the stomach, and make a connection from the stomach to the cyst.
And the fluid will drain out into the stomach.
Yeah.
And the percutaneous you're talking about, like from the skin here, just put the needle straight through.
Correct.
And drain it.
Correct.
Okay. As far as what I want to do is change it to chronic pancreatitis, because I understand that acute pancreatitis and chronic pancreatitis is almost two different diseases. Yes. Tell me more about chronic pancreatitis.
So chronic pancreatitis, again, usually relates to situations where you're going to have repeated chronic insults to the pancreas. So one of the common things, again, like we spoke about, is alcohol abuse. So patients who have chronic alcohol abuse with repeated insults to the pancreas over time will get chronic pancreatitis. Now, what chronic pancreatitis is it's the result of repeated insults where the pancreas now becomes much smaller. It's atrophied, and that means it's much smaller than it was before, and it becomes very scarred and hard. Two consequences of that. One, because it's smaller and there's less tissue there, it has less enzymes, it produces less enzymes. So one of the consequences is you're not able to digest food as well. And typically it's fatty food that you're not able to digest. So patients have intolerance of fatty food. So when they eat a fatty meal, they get diarrhea. It just goes all the way through. The other thing is, depending on how much damage there is, again, because the pancreas produces insulin, you can become essentially a diabetic because you don't have enough insulin. So those are the two chronic sequelae. The other thing is, which comes into play for us as surgeons, is chronic pancreatitis produces chronic pain. And one of the things, there's several operations that we can perform to try to facilitate or alleviate that chronic pain. So those are the three things mainly that chronic pancreatitis.
All right. Because you have a hard time, now you say that one of the enzymes that one of the elements that the pancreas secretes helps us break down our fats.
Yes.
Is that correct? Yeah. So do we lose weight when we have this problem with chronic pancreatitis? Or
you lose weight, but not in a good way.
No. It's not because you want to.
Right.
Okay.
You lose weight because you're not able to digest. So you'll have diarrhea.
So it's almost like you eat it, it stays in the bowel, but you don't absorb the nutrients from your food.
Correct.
So it just goes through you, and you never got never got the nutrients absorbed into your body, so you never were able to use those nutrients to gain weight.
Correct.
Oh boy, that's interesting. What are some of the things? I understand that sometimes with the younger people, I was reading something where cystic fibrosis may cause pancreatitis or chronic pancreatitis, and I understand cystic fibrosis is like a mucus that's produced by the body, really thick mucus produced by the body. How does that happen to affect the pancreas, or how does that come about?
So just like how it affects the lungs, actually, which you probably know, the mucus itself gets, because the fluid itself cannot flow easily, it actually obstructs the duct. And again, like we spoke about before, once the duct becomes obstructed, things can back up and lead to swelling and inflammation.
Right.
So with cystic fibrosis, this is happening at a very early time point, and it's happening throughout the pancreas. So it's not just one area, it's the entire pancreas where this is happening. So you tend to get repeated insults of acute pancreatitis over time, which will lead to chronic pancreatitis.
Okay, all right. There are certain things I want to cover. One of the things is, and I know that you're an oncologist, I want to cover pancreatic cancer. Can you tell me about the cancer, what type of cancer develops in the pancreas?
So it's typically, the most common cancer is what we call pancreatic adenocarcinoma. And adenocarcinoma means it's a cancer of the epithelial tissue that forms glands. Now, the most common cell that's in the pancreas is a glandular cell.
That means it forms glands.
Forms glands,
right? And glands are what secretes the enzymes.
Right.
Okay.
So that's the most common cancer. Now, there are other types of pancreatic cancer related to the other cell types. So the cell type that secretes the insulin, you could get a cancer from that. The cell type that secretes the glucagon, you could also get a cell type from that. But by and large, when we say pancreatic cancer, we mean pancreatic adenocarcinoma. That's what typically it means. Now, just to put it in perspective, it's one of the more aggressive cancers that we deal with. So it's about 40,000 cases a year is an incidence, which means the new cases that develop. And roughly close to that same number die every year. So the incidence is almost equivalent to the mortality per year. And usually whenever you see that, you can tell that it's a very virulent cancer. Unfortunately, our ability to treat this cancer hasn't changed significantly over the last 40 years. The drugs that we have are a little bit better. The surgery is much safer than it was before. But if you look at the overall outcome, our success rate with pancreatic cancer isn't very great. And there are a couple reasons. By and large, it's a very aggressive cancer, and we don't have any effective screening methods to detect it at an early point. Usually when patients present with pancreatic cancer, they present with jaundice.
Okay.
Once you present with jaundice, that's typically at a point where it's already advanced. If they have pain also, that's also at a point where it's advanced.
Okay.
So these are things that already put you behind the 8 ball, essentially, because it's an aggressive cancer from the outset, and usually we're diagnosing it at a late point. So those two things affect our outcome.
Now, once you diagnose it, what treatments are available? I mean, what can we do?
So depending on what stage it is. So after we make the diagnosis, the next step with any cancer is to stage it. And depending on the stage, the treatment will vary.
Right.
So when we stage a cancer, we have to look to see if it's localized, if it's only in that particular organ, or if it's spread to other parts of the body. Now, our ability to cure cancer is predicated as long as it's localized.
Right.
If it's spread, then
we have a problem.
we've lost that ability to cure.
Okay.
So we use tests like CAT scans, MRIs, to try to stage a cancer to see if it's localized or if it's spread.
Right.
If it's localized, then we have the ability to surgically remove it.
Okay.
Once it's spread, then we have to rely on other things like chemotherapy and radiation.
All righty. I trust we had more time to talk about it, but the show has to wrap up. We'll have to get you back. Dr. Clark, thank you very much.
Thank
It's
you.
so interesting. Oh, my goodness. In closing, remember, caring and sharing, www.medmoments.com. I trust that each and every one of you out there continue good health. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all.